Good morning. Please come on in, have a seat. Is it Elizabeth Imani?
Yes, that's correct.
Hello, I'm Lindsay, one of the doctors in clinic today. Just so I know, how do you like to be called?
Mrs. Imani is fine.
Great, Mrs. Imani. What can I do to help you today?
I'm kind of worried. I don't know how to say it.
That's okay. Just to reassure you, everything that we talk about today is completely confidential, so feel free to say anything at all to me that you like. I don't share information with anyone unless I'm very worried that you or somebody else is at very serious risk of harm, and I'd make sure to speak to you first about that.
Okay. I have an issue, you see. I've been experiencing some pain in my tummy and some discharges around my private parts. I just want to know what it is.
Absolutely. If it's okay, I'll just ask you some more questions about that. These are completely routine questions that we ask of everyone, but they might seem quite personal and a little bit strange. But we ask them just so that we can understand your health history better and know the best way that we can help you today.
Okay.
While we're talking, I might like to take some notes on the computer, so I might not be looking at you, but please be assured I'm still listening. Okay, thank you for answering those questions for me and for describing your symptoms. Based on what you've told me, I think it would be really important that we examine you and take some swabs for STIs and other infections. Is that all right?
What does STIs mean?
Oh, sorry. So STI stands for sexually transmitted infection.
Okay, and what kinds of tests are these you will be doing?
So the tests that we'll be doing today are swabs for common STIs like chlamydia and gonorrhea, but also for other infections like thrush, which aren't sexually transmitted. We also offer everybody blood tests for HIV and for syphilis. Would you like to do these today?
If you say it's worth doing.
Great. Let me just add those to the computer and we can get the samples needed. So your results should be ready in 7 to 10 days' time, and you can get the results by calling the number on this card. If anything was to come back positive, we would invite you back here for treatment and to discuss future prevention. But try not to worry, okay? Let's just take things one step at a time. Thank you for coming back to see me, Mrs. Imani. As you know from your earlier conversation with the nurse, your chlamydia test has come back as positive. Chlamydia is a common bacterial infection that's passed from person to person through unprotected or condomless sex with somebody who has the infection. It's easy to treat with a course of antibiotics, and I'll be taking you through the treatment plan today. All of the other tests came back as negative.
I just don't understand how I could have that, doctor.
I understand that this must be very worrying for you. Is there any questions that you'd like to ask me at this point?
Not just yet, doctor. Just continue.
Okay, I'll just take you through the different treatment options now. Also, Mrs. Imani, from what you've told us, it would be really important that your husband also comes in to get testing and treatment if he also has the infection. Is this something that you feel like you could discuss with him?
No, doctor. I don't even know how to bring it up with him. This is all a bit too much to take in right now. Please, I can't tell him just yet.
I understand how difficult this is, Mrs. Imani. If you like, we can help you to tell him and also make an appointment here for him. But please know there's no pressure to do this immediately. It's just that if you both have the infection and only one of you is treated and you have sex again, then you could just pass the infection back and forth to each other. And this could lead to more serious complications for you, such as a more difficult infection to treat in your womb. In addition, Mrs. Imani, I know that you mentioned just being with your husband, so I'd like to reassure you that I'm not trying to offend you or make any assumptions by saying this. But sometimes when people test positive for an STI, they might be at risk of other STIs and of HIV. This is because they're all transmitted through sex.
HIV.
We routinely talk to everybody in similar situations about this. Many STIs, like chlamydia and gonorrhea, are easy to treat with a course of antibiotics. HIV is a little bit different, and although there's no cure, there are medications available that mean that people living with HIV can expect to live normal, healthy lives. This treatment also means that they can't pass HIV on to other people. In addition, we also have a medication called PrEP, which can prevent people from getting HIV in the first place. Have you heard of it?
No, what is it?
So HIV PrEP stands for pre-exposure prophylaxis, and this is a medication that people can take to reduce their risk of getting HIV if they were to have sex with somebody who has HIV and maybe doesn't know that they've got it or aren't on effective treatment for other reasons. We've had this medication for a long time now, and it's proven extremely effective at reducing the risk of HIV through sex.
It sounds like an expensive type of drug. How much does it cost?
So you don't actually have to pay for PrEP. It's available for free on the NHS in Scotland, and you can get it from any sexual health clinic like this one. Some people do choose to buy PrEP online, and that is an option that's available. But if you choose to do that, we just ask that you do so from a trusted seller, and ideally that you still attend sexual health clinics for monitoring. For women, PrEP can be taken every day, just like the pill, to prevent unplanned pregnancies. If you like, here's some more information about PrEP and also about PEP, which is a different medication that stands for post-exposure prophylaxis, and this is a medication that people can take after they've possibly been exposed to HIV.
But doctor, I'm married and not having sex elsewhere. How come you're recommending these to me?
I understand, and like I said, I'm not trying to offend you or make any assumptions. We routinely offer this information to everybody in similar situations, regardless of their relationship status. I know I've given you a lot of information today, Mrs. Amani, so please take your time to think about things, and if you want to come back and have a chat with me in the future, please feel free to do so. Please also don't forget your antibiotics.
Thank you, doctor. I'll consider everything you have said.
Okay, and thank you as well. I wish you all the best. I appreciate that clinic settings can be a bit overwhelming, so if you'd like to speak to somebody else not associated with the clinic about everything that we've discussed today, there is a group called Waverley Care. Waverley Care is a charity that's based within the community, and they have staff who are trained to offer confidential information, support and advice to all communities, including those of minority ethnic backgrounds. If you like, here's some more information and how you can contact them.
Thanks again, doctor. Goodbye.
Okay, so these videos were created as educational resources to help clinicians understand how to have culturally sensitive conversations about PrEP with people from ethnic minority communities. They also serve as a very useful tool to educate community members on PrEP in itself and what they can do when it comes to accessing PrEP. So what we did was we put together conversations, extensive conversations with clinicians to understand how they have these consultations in the clinic, and also with community members to know how they would like the conversations to go when they come to access services. All of the goals that sort of championed this project came out from these workshops. So as a clinician, Lindsay, what were your key highlights from producing and being part of the filming of these videos?
Yeah, I think there was quite a few really important learning points for healthcare professionals. The first one just being how important it is that we remember to always ask a patient how they'd like us to address them, because I think that can really help to build a sort of respectful doctor-patient relationship. It helps to establish rapport, and it can really help to put the patient at ease. Sometimes also, I think, as clinicians, we use words or phrases that might have a different meaning from the one that we intend. So for example, when we were speaking about trying to get the partners in for testing and treatment, we found that if you phrase that differently, it can sound quite sort of presumptuous or blameful for possibly passing on an infection. So to avoid that, we found talking about the possibility of both partners having an infection to kind of avoid that directional, presumptuous kind of language. Also, sometimes people might not want to completely disclose very private or personal information, especially not on their first attendance in clinic. So I think we really do need to be mindful of that and make sure that we provide all patients with the same information that's comprehensive and easy to understand.
That's really interesting, because those were some of the key points that came out from the workshops with community members. You know, they wanted to know that the information being provided wasn't used to target them. It was more information that is provided to everyone or anyone in similar situations, so they don't feel singled out. They also wanted a situation where they understand why they are being asked some of these questions. So it's not about being nosy, it's about trying to create a picture of your health history, which the clinician can then use to help, you know, address whatever needs the client has. And I guess the third main thing that came out was in terms of terminology. You know, the community member said, I would rather the terminology that's used is simplified or explained so that I can check if that's the same knowledge I have. And in a way, that helps to challenge the misinformation that, you know, still exists around HIV. If someone thinks something, but it's not right, that's the opportunity for them to get it right.
Yeah, and I think the last thing as well that I was really reminded when filming these videos is just to remember how stressful and challenging this consultation might have been for the patient, and to make sure that I always thank them for their time and their patience. That might help them as well coming back again in the future.
Absolutely. It builds a very good relationship between patient and clinician.
Mm.
Yeah.